the pregnancy should be single pregnancy. It should not be a twin pregnancy or a triplet pregnancy. That you are in hands wherein the heartbeat is monitored once in every 15 minutes and your or safety concerns, that is the reason she wants to do a cesarean. I'm Dr. Shery, consultant gynecologist at Supreme Specialty Hospital. So today I would like to tell you or talk to you about VBAC. VBAC, it's nothing but Vaginal Birth After Cesarean section. It also is commonly known as TOLAC or Trial of Labor Following Cesarean section. Now VBAC has become a big boon in these days. Remember, no doctor wants to do a cesarean unnecessarily. In fact, doing a cesarean is a lot of toll on the doctor. So nobody wants to do a cesarean unnecessarily. But there are situations or safety concerns. That is the reason she wants to do a cesarean to safeguard the mother and the baby. Now, however, we would go into the discussion, and vaginal birth after cesarean section is mainly a boon because it leads to faster recovery, earlier return to normal life, and improves the quality of life. Now, I would also tell you a few things that is very important to consider before doing a VBAC. One, the previous cesarean which was done should not have been an emergency cesarean. Like, for example, there was a heavy bleeding due to placenta previa or heavy bleeding because of abruptio placenta, then it is better not to opt for a VBAC in this pregnancy. The previous pregnancy should not have had any wound infection in the post-operative period. The previous pregnancy should have been a smooth one without any complications. These are the few things to be considered from the previous pregnancy. In the present pregnancy, we need to look at few things like the pregnancy should be single pregnancy. It should not be a twin pregnancy or a triplet pregnancy. The fetus should be in the head down position, or we call it the cephalic position. There should be a good amount of liquor or fluid level around the baby should be very good. The placental position is very important. The placenta should not be in the lower part of the uterus. It should be either in the lateral aspect or in the fundal area of the uterus. The heartbeat of the baby should be good, and the mother should not have had any obstetric complication like any placenta previa in this pregnancy, or there should be no problems like GDM, that is gestational diabetes mellitus, or hypertension in pregnancy, or there should not be any anomalies to the fetus or any problem with the baby. So these things we need to consider before considering a vaginal birth after cesarean section. Even during labor, it is better that the labor pain starts on its own rather than inducing labor. It is also important that you are in hands wherein the heartbeat is monitored once in every 15 minutes and your obstetrician is available with you all the time. You have a pediatrician available round the clock, and you also have an anesthetist with you round the clock. However, we do assure you that we have all these facilities with us. And also, it is important to also get a consent from you that in case there is a scar rupture or scar dehiscence, you would be immediately taken up for a cesarean section, because what happens is the previous scar tends to weaken during the labor. When you are labor, when the uterus is at its maximum power, there is a high possibility that the scar which is present in the lower part of the uterus can weaken or can give way for the baby or the mother. The problem that can happen to the mother is overbleeding. So to prevent all this, to give you a safe mother and a safe baby, a cesarean section might be done as an emergency.